All right, good morning, everyone. We're going to go ahead and start now. Thank you so much for joining us. My name is Dr. Yasmin Farshad, Practitioner Education Manager for Wise Women Herbals, and I want to welcome you to this month's Practitioner Forum call through the Wise Women Herbals Practitioner Learning Community. If you've attended our previous events, thank you so much for joining us again, and if this is your first time, we extend an extra warm welcome to you. Presentation is entitled Botanical Support for Allergies with Dr. Glenn Nagel. And during today's call, Dr. Nagel will be going over details about what exactly is going on at a physiological level when you're having an allergic response and how that manifests into symptoms, internal and external factors that may be triggering allergies, how herbs work in order to help support a normal, healthy immune response, as well as clinical indications and contraindications of these herbs. This is an interactive event, so this is a great opportunity for you to actually ask the expert yourself. So if you have questions, please feel free to send them via the chat box option at the bottom, and I'll go ahead and ask Dr. Nagel as we go. Dr. Glenn Nagel has been a practicing herbalist registered through the American Herbalist Guild since 1984 and is a naturopathic physician. He's been a consultant to the herbalist industry for many years and is deeply passionate about botanical education. He's a former associate professor of botanical medicine at National College of Natural Medicine, Bastyr University, and is currently an adjunct professor at National University of Natural Medicine. So without further ado, I'd like to present to you Dr. Glenn Nagel.
All right, welcome everybody. I know some will be jumping on here as we go through this, and I'm definitely, like all these practitioner calls, there's a lot of information. You're going to have access to these slides, and so some of them I'm not going to talk about every slide. I like to give you a lot of information, but we want to go over the overview, and allergies are a big concern this time of year. It's very topical. Here's our disclaimer. These are all my thoughts and ideas. I want to start by just talking about botanical medicine in an overview. This is something I really like to talk about, is that we have an action of an herb here in the center. This is how the effects of the herb. And I like to think of the therapeutic triangle is that we have our traditional knowledge through ethnobotanical use. So if you start thinking about herbs like turmeric, holy basil, I mean, we have such the green tea, such a long history. That makes me interested. How do they use it? What do they use it for? Then we have scientific research. You know, it's really important. What does the clinical study say? Is it researched? You know, a lot of times you hear, oh, there's no research on herbal medicine. Well, I do a lot of research on PubMed, and I mean, there's hundreds of studies, thousands of studies on herbs. They're not drug studies, they're herb studies. So, you know, and then what's your own personal and or clinical experience? And so this is the place that, because botanical medicine is a web of activity, I like to think of it as like, you know, each little therapeutic chemical has this web effect. And so everybody can have different effects, personal. So if you take an herb and like it helps you, it doesn't help you, somebody else it could really help, and that's different chemistry, different detox, different kinds of medicine. So this personal approach. And so when you're done with that, you know, what I really like to see is that you have all these balanced, and in the middle you have that action, that activity. And so some herbs have a real strong traditional use, some have a lot of research, some you just have your own experience with, and maybe it's a minor herb. So think about this in like, when you look at an herb, you hear about it, think about, you know, does it have these three components? Because when the three components are present, that's when you get the strongest activity. I'm also going to talk a little bit about synergies, like how do herbs work? Well, you know, I say it's a web, but what I like to think about it is all these components are added, and I like to think of it, the most useful herbs have the most complexity usually, and I think of it like having a lot of extended family. If you need help and you have grandparents, cousins, uncles, it's like all those people are at your disposal. And so the therapeutic outcome of an herb depends on the chemistry and the extraction method and the farm and the essence and the dose. And there's even potential placebo effects. All these things throw in the hopper. And so the more balls we can bounce, this is what's so great about herbal medicine, is it's not a monotherapy. I think drug models like having one rich cousin. Maybe he's out of town. Maybe he's not going to talk to you. You got no help. The herbs, there's always this web of support. And so this is really important because as we talk about allergies, it's a multi-layer approach. So I want to highlight this component, which is the study that came out a few years ago, but I think it's really important, and this is going to be kind of the key topic from today's finding, is that we're all aware of global warming. We all know it's affecting our life, the more crazy weather patterns, extreme. But in relation to health issues, this was an interesting study done by I think of the World Wildlife Fund and the Asthma and Allergy Foundation of America. And they found that unchecked global warming will worsen respiratory allergies, and that more allergies, more global warming means more CO2, means more allergens, could mean more asthma and allergy attacks. And so we all know that allergies have been growing since about 1980, but lately this study is great, and I've put it into the notes so that you can review it, but I thought this was interesting based on CO2 content of the year. You got to remember, CO2 is plants' food. So as global warming and oxygen decreases and CO2 increases, this is the theory that right now 370 parts per million of CO2. In 1900 it was only 280, and prediction somewhere in this bar here that it doubles by 2075. Well, you have to remember CO2 is what plants need, and so global warming is going to be bad for humans and other life forms. It's going to be great for plants. This study also came out with the Union of Concerned Scientists, and they talk about global warming and allergy symptoms, and they say global warming is the miracle grow for weeds, right? CO2. And so they said these three key factors are what we're going to see with global warming, is that we have increased carbon dioxide from trapped gases. That's going to help plants grow. Plants are going to pollinate. Pollen is going to be released. The rising temperature, here in Oregon, we see that, in that study that show that the USDA maps of zones for plants are changing because you can start growing warmer crops in climates. And then there's extended spring because winter is milder. There's less winter in certain parts of the country, and so we have longer bloomings. All these things lead to the fact that we better understand how to help with allergies because it just seems like it's going to get worse. So I'll go over a little bit of primer on allergies, just this idea that we have different types of allergies. I'm talking more about the seasonal allergies or allergic rhinitis, but food and pet and danders and pollen, all these allergies. So airborne allergies and inhaled allergies. We know that at 50, or even now, I think the studies are more like 70 million. 1 in 5 suffer from allergies. You do any intake doctor form, they say, what do you have as allergies? And I remember looking at those forms as a doctor, and lots of allergies. And typically there's allergies, asthma, and eczema. That's the triad. You see those three things together. And so it's oftentimes important to ask about allergies, about skin problems, and about respiratory. And so respiratory support is what we're going to be talking about. And, it's the fifth, maybe the third leading cause of young people, 40, 50, 60 million. And animal danders, cats and pets, it's harder to deal with animals because, hey, do you want to get rid of your pet? But when you have people tested, you can see what are the allergies. And so there are different ways to test for these triggers, but the most common indoor, outdoor, the trees, grasses, and weeds, pollens, mold. Wet places have a lot of mold, dust mites. These are bugs, and cat and dog and rodent dander. Cats seem to be more allergic than dogs. And pollens, you tend to think of grass, trees, and weeds. Trees tend to come out earlier in the spring, grass in the summer. and weeds tend to be heavily in the fall. That's kind of the thing. And if you look in news reports on weather, they oftentimes have little pollen charts. What's high? Because if you have symptoms, you want to correlate it to what's out in the air and how to identify what that specific thing is. Now, this is a concept I didn't invent, but I really like to bring to people's attention because it's the total allergenic load concept. And I look at it as the allergens are the water, and the body's response or the immune system is this cup or glass. And so as long as you have room, you can constrain, you can hold the allergy symptoms at bay. And so say here in this example, you have some allergies, maybe there's food allergies, maybe there's pollen allergies, but there's still a good response. The immune system can contain those symptoms, hold them in control. But over time, and typically, especially seasonal allergies, as the season kicks in, all of a sudden you have a bigger antigenic load and the water fills up much higher. And then once it gets to the top, it spills over, you have symptoms. So you want to address two main therapies, and that's one, lower the load or increase the body's ability to respond. And so strengthen the immune system, decrease the inflammation, and we'll talk about herbal therapies for that. But one of the ways we look at seasonal allergies is that if you have food allergies, they could have the cup half full all the time. And then when seasonals come in, they overflow. So it's oftentimes very helpful in the clinical use is to address underlying food allergies because you eat every day or likely. And so if you can lower the food allergens, you have more room to deal with seasonal allergies. And I can remember a patient with really bad seasonal allergies is when we took out their dairy and wheat allergy, the seasonal allergies became so much less without any treatment because we lowered the antigenic load. So think about that in relation, meaning you may not get rid of your cat, but you can cut out foods in your life and that will lower this load. So this is a really important concept to understand, that all allergies are cumulative. They all add up as stresses, even though the different kinds of allergies, you may not have a pollen allergy, but you may have a food allergy. And they're triggered by various substances. The allergens are typically protein related. And cats are bad because they lick themselves, and the saliva has allergenic components. The little pollens from airborne, they get in your immune system. And so when I lived in a very dry climate in Colorado, we had a lot of allergies because you got to remember, respiratory tract, nose, mouth, lungs are designed to block that. And so one of the things as a treatment that's so easy to do is make sure you're properly hydrated. Because if you think about inhaling spores from airborne, if your mucous membranes are dry, they allow the pollens to get into the bloodstream and stimulate an allergenic response. So hydration is really good. These respiratory triggers, they're by inhaled, and typically the idea is you're exposed, it's not so bad, and then after a period of time, you get exposed again and your body's been targeted and charged. And so this is the idea that the first bee sting, you don't get a response. The second one, your system has been charged by immune molecules. And so typically you'll see somebody move someplace so they don't have a problem. But after so many years and aging and exposure, they become sensitized. And so the key thing is you have to be exposed to an allergen and you have to be sensitized. And how you get sensitized is, like, again, that total allergenic load. Some people get exposed and never have a sensitization, and other people get exposed and they create a sensitization. So you can't always avoid those, but if you're not exposed, you won't get sensitized. This is a really great little chart too, because you got to remember allergies, especially the seasonal allergies, it's like we have this little cross. So down below here, it's underactive, and above, it's overactive. And then to this direction, it's external. In this direction, it's internal. And so seasonal allergies are overactive external, or though it could be overactive internal if it's food allergies. If you have an overactive and it's internal, you can develop autoimmunity, and autoimmunity is the body attacking itself. Again, immune balance is what we're really looking for. That's in the center here. If you're underactive immune system and it's internal, it can lead to chronic disease, cancer being one. If it's underactive external, the infection model can lead in. So what we're really looking for is a balance, because most allergies, the seasonal allergies, are an over response that you can't bring down to a manageable level. And that's the key thing, is how do we balance the system to bring you kind of into the center here? Because we don't want to be underactive either. We want to be balanced and toned. And this is where botanicals can really help, because they have a biphasic effect that allows us to be balanced. So I'm not going to go through the details of the allergenic response, but you're exposed, and you can create IgE antibodies from pollens and danders and plants, and IgG, which typically come from foods, which are called delayed sensitivities. There's type 1, type 2, type 3, type 4. But typically IgE are these ones that are very histaminic, and you get the symptoms of runny, watery, itchy, scratchy, swelling. The scratch tests that doctors do on your back test very well for IgE. The food allergens can often be tested by IgG. So food allergy tests by blood measuring IgE and IgG are oftentimes a good screening model. The general thing I would say in practice is you can do blood tests to give you kind of a list, but eventually you have to try to eliminate or decrease your exposure so you're not sensitizing your system. So it's kind of time versus money. If you've got the time, you could just take things out of your diet, try to change inhalants. If you have more of the money, you can do tests to kind of give you an idea. But once you're exposed and these little mast cells degranulate, they produce antibodies and chemicals that try to help body respond. So it's a healing response. It just causes symptoms that are very uncomfortable. And so herbal actions, how do we support? Well, the pharmaceutical drugs just block, and there's the COX-1 and 2 inhibitors, and they prevent binding to the target receptor. So they block the mast cell from degranulating and creating symptoms. You still have the allergenic response, it's just masking it. And one of the things we know about allergy medication, especially nasal sprays, is they can cause a lot of rebound, meaning when you go off them, you get much worse. And they can be fairly addictive because of that, meaning I had a friend who's got a nasal a spray that he uses for allergies, and he was like, oh, if I don't take this, my symptoms get a lot worse. And then the other piece that he had is it's not covered by his insurance, and so it's like a $300 copay for a medicine that doesn't really help underlying, it just helps the symptoms. And so when we look at herbal actions, we really want to think about herbal anti-inflammatories, things that can help block, and turmeric and ginger and some of the herbs we're going to be talking about today, feverfew as being one. They're a long-term strategy that can work to help block this without having the suppressive effects of the drugs. And symptomatic treatment is great when you need it, but it's not dealing with the symptoms underlying. And so you still have allergies, you still have those imbalances, it's just you're blocking it. So symptomatic suppression is a band-aid. And so oftentimes if you're helping and working in a counseling coach or a therapeutic relationship, people will be doing these over-the-counter things, but they're not doing all the lifestyle and diet things that can help to lower that allergenic load. They're just like, I know it's bad. And that it's a tremendous amount of money spent on ads getting people to take seasonal allergies relief, but we want to look like it's underlying. So just don't treat symptomatic. And so here are some really key components: is supportive symptom management using herbal decongestants, restoratives, and mucolytics, things to help break up the mucus, uh, stabilize the mast cells using herbal anti-inflammatories. And the other thing we think about is herbal adaptogens, adrenal support, things like licorice and things I talked about in early webinars, holy basil and ashwagandha and reishi mushrooms. I really think is a great mast cell destabilizer, anti-allergy, immune balancer. And then modifying the underlying contributing. So somebody avoids the foods, the animals, or the danders. You can't really stop breathing, but there's a lot of information out there about, making your indoor air filters, HEPA, like getting out. Especially, we would oftentimes in clinical practice focus on their bedroom, because if you sleep in a room for 8 hours a night, can you make that room as clean as possible? Get rid of allergy, rugs and things that hold pollens and dills, dander. You can bring in a HEPA filter. You can put filters on your screen in your windows so the pollen doesn't come in. Work with the immune system, work with stress management, because cortisol and stress hormones, and cleansing and detoxifying. Doing a spring cleanse oftentimes means it resets the immune system, it balances, it takes away some of those allergenic loads. People feel lighter, they respond less to seasonal allergies. So let's talk about some of the herbs. Probably the one that comes up the most, everybody loves eyebright. And so eyebright's thought of typically for irritated, watery eyes, right? Usually a bland discharge. And if we look at this little plant, it's in the Scrophulariaceae family. And I've seen it in the wild and I've collected it. It's a challenging herb to grow because it's saprophytic. Its roots grow with other plants. And when you look at it, it's a tiny little plant. I mean, really, it's like 3 inches, maybe 6 inches at most. But it has this huge flower. And I think of the signature as the flower is kind of like a face, thinking about the eyes, and it has this bright kind of eye model. And so it's all about eyes, nose, and throat. Although this one seems to work best, nose and eyes. It's also good for lungs a little bit, but we think about for eyes, so it was used as an eye wash. The key thing on this is if you gather it fresh and you extract it or dried, it turns a really black tincture, and it has these iridoid glycosides, which are anti-inflammatory and antimicrobial. So the key thing about eyebright is that it's astringent and antimicrobial without being a tannic-rich plant. And so tannins, astringent, are antimicrobial, but they're drying, and sometimes that's useful. But eyebright is less irritating, because if you think about putting black tea in your eye, it's very astringent and it will help to cleanse the eye, but it could be too drying or too irritating. And so this is where eyebright's really good. The iridoid glycosides are also found a lot in things like Plantago officinalis, Aucubin being the one. And so, nourishing and strengthening. And so it has a natural anti-inflammatory, astringent without being overly astringent, and antihistamine effect. And so this is our key thing for eye issues. Taking it internally for sinusitis and for seasonal allergies. And the dose is pretty appropriately. You can use a few drops. There was a lot of issues with the quality of it, getting it from Europe. And so really work with your suppliers like Wise Women to make sure you get a really high quality product, because for many years this was difficult because of the growing situation. I can't just cultivate a field of it. Most of it's still wild collected. Now a key one we all think about is nettles, stinging nettles. And this is a Johnny come lately for the allergy model. Actually, I was around in the early 90s when I was working with a company here in Oregon that developed the first freeze-dried nettles. And that was the first way we understood that they could be helpful for allergies. I mean, traditionally, nettles is a nutritional alternative. It's a diuretic. It was anti-arthritic. It's anti-inflammatory. It's a mineral and a protein source. It's about 25% plant protein. So dried nettles, super nutritious. A lot of minerals. This is a young picture I took of a young plant. You can see when it's young in the spring, like this time of year, it's purple. And that purple is antioxidant pigments. So we were doing research on fresh nettles, and we did a antioxidant test. And we found that fresh nettles like this out of the spring ground had a equivalent to a green tea as an antioxidant, about 8% antioxidants, which is super high. The anti-allergy thing really came from the fact that the experience we had years ago, which started this whole thing, because there was a study done that I was involved with in 1989. Nettles had a Planta Medica study showed that stinging nettles had an anti-allergy effect, and these were done in the freeze-dried form. Freeze-dried probably is best, but all forms of this can be helpful. And so we got to look at the constituents to really understand it. So we have these are flavonoids, which are nutritionally tonic. We have the chlorogenic caffeoylmalic acid, which those things are antioxidant. But it's in the stinging hairs, these little trichomes. We have acetylcholine, we have histamine, we have serotonin. Neurotransmitters. Histamine is going to make you worse. So how does the histamine in a plant help allergies? Well, I think it really works from a little bit stimulates your body to respond, to bring in balance. And so if you get stung by nettles, they have these little hairs called trichomes, and they look like this, right? And so you get stung, they inject those chemicals, histamine, serotonin, you get this urticaria rash. If you stimulate the rash externally, it actually helps internally. And so I think my best nettle treatment is get stung with fresh nettles if they're available, and that helps symptomatic relief. It also helps inflammatory joints. Next, taking the internal use. Eating nettles is a great tonic in the spring where you have them. So nourishing, different forms. I would say that fresh is best, freeze-dried, and then tincture. And probably air-dried nettles in a capsule would be the least helpful. Now, it is such nutritional tonic that it can help, and those components are in there, but when you air dry it, the little histamines are destroyed. And so the tinctures are extracted a little bit, and there's some in there. So typically we think of it for low states of stagnation, depression. This is a building herb. My little sign for this is tear it down, build it up. So nettles really get at the foundation of building a healthy immune system, and they're detoxifying. And so for most of the seasonal and food allergies, nettles can be very, very helpful. What about golden seal? Well, golden seal, typically we think of it as an herbal antibiotic, but that's a big myth. It's really more of a mucous membrane tonic, and it's definitely good for bacterial secondary infections. So I think of allergic rhinitis as being overstimulation. Typically it's clear discharges. Hydrastis key indication is a thick yellow mucus. Like the yellow in the root, has the berberine, has hydrastine. It's astringing, again, without tannins, and it's antimicrobial. Oregon grape would fall into that mindset. Oregon grape probably more sustainable, more available. Some would say not as strong, but typically this was never used for colds. It's a king or queen of the mucous membrane tonics. And the way it really works is it has astringing properties, and then antimicrobial effect from the alkaloids, but also it stimulates healthy mucus. And so what this one does is it refreshes the membranes with healthy mucus, and the healthy mucus keeps infections at bay. So this is oftentimes useful in the allergenic, seasonal allergenics that work into sinusitis and infections. That's where it's really key. So when there's a colored discharge, we think of a yellow-green. We think of hydrastis as a mucous membrane tonic. It's also helpful to do it as a nasal wash. And you can drop the tinctures into saline, a dropper of the tincture into an ounce of saline, and that will dilute the alcohol, and you can gargle with it, you can wash it up your nose, even potentially use it as a eye wash. the key thing on this is doesn't need a lot, a few drops, 10 to 20 drops in a formula, like 10% mixed with other things. A lot of people tried to use a really high dose, tried to kill out an infection. And concept with that is it often dries up the membranes and could be irritating. Now in allergies that can be helpful, so I'm not saying that that's something you can never do. But Golden Seal, really great. Think of it more of the end stage where it starts moving into other things. Now, simple things we have at home, almost all mint family plants with essential terpenes like thyme. Thyme oil is thyme itself is super potent. If you've ever had really good thyme out of a garden, I mean, you bite into it and it starts burning your tongue. We have this available as an herb in your kitchen. I've had patients take thyme out and make a tea. So it's really the terpenes, the volatile oils, especially thymol. And very similar, I think of this as a great substitute for eyebright. Because look, it has volatile oils, it has caffeic acid derivatives, it has flavonoids. So it's similar, but much more available, much more sustainable. And everybody has it. So you could take thyme and make a tea, and it's very safe. The thymol, if you're using essential oils, they're very, very potent, especially thymol. Like here, thymol, you have to dilute it 1 to 2%. But this one's very much antiseptic and astringent and anti-infective, and it refreshes the membranes, and it has an anti-inflammatory effect. It seems to calm the membranes. So this was used for a mucousy cough, a mucousy sinuses. And you think about thyme, it's a pleasant taste. If you take it if you make a tea of it, most people won't associate it with tomato sauce because it's in a different, when you put it in food, you kind of think, oh, this is the thyme flavor. But when you take it separate or put it in a formula, it's pretty tasty without getting this idea that you're having. Now, lobelia is a great one. You could do this whole webinar on lobelia. This is more of a low-dose herb. I know it's a practitioner-only product. And the thing about lobelia, it's a Native American remedy found by Samuel Thompson, a historical. It has piperidine alkaloids. These alkaloids are strongly antispasmodic. It's a beautiful plant, grows wild in the Northeast. You can grow it in a garden very easily. Just remember, don't confuse it with garden lobelias. You go to the garden center, they have a lot of lobelias. This is Lobelia inflata. It has these little inflated pods. You can't quite see them here. It has a lot of little seeds. Here you go. You can see the pods. The thing about lobelia is that it's a relaxant and a stimulant. So large doses relax, small doses stimulate bronchial dilation. And so it's a smooth muscle antispasmodic, and too much causes nausea. And that's the key thing. If you're nauseous, you could lead to vomiting. And historically, a long time ago, they felt like it was a great emetic, meaning they would use it to get people to throw up. It's not how we want to use it. And so if anybody's taking lobelia, it has an effect like tobacco where it kind of binds in the throat, but a small amount can help respiratory breathing. And so this more fits into the allergies toward asthmatic condition. And you want to be somewhat familiar and have had experience with it. It's not a simple, safe little tonic herb. It has, it's very safe, but it's more of something that you would use in a combination. Typically, it's put in about 10% in a formula. A few drops, and you always want to tell people that if you get nauseous, just stop it. But it's a great herb for bronchial spasming. Inula, this is one of my favorite herbs because it's very, very common. It's aromatic, but it's also a very good expectorant. So you got to get something to break up the mucus. And so this one, I think of this as a great combination. I love this combination with elderberry. Elderberry being kind of immune modulating, antiviral, anti-inflammatory with all those pigments, as well as antioxidants. So I like to add the elderberry concentrate syrup with inula, because this one has a great expectorant and so it's antimicrobial, but it helps break up. We always have a lot of phlegm, you know, whether it's thin and runny or thick. It's also been used for lung where there's conditions there. As antimicrobial compounds, which, you know, are going to really help these sesquiterpene lactones, and it's very available. So it's a little bitter, it's a little aromatic, and it goes great with things like elderberry because then it sweetens it up. Horseradish, amazing. Horseradish is amazing, mostly from the fact, like, okay, who hasn't had wasabi, right? Now I'll separate, and there's a whole another slideshow on wasabi, but true wasabi is a different plant. It's wasabi japonica, and most of the wasabi you buy to eat with sushi is horseradish, colored with green color. So real wasabi is very, very expensive. If you go to high-end sushi places, they'll have real wasabi. They both are helpful and they both work similar. The key thing on horseradish is, where do you feel horseradish? You know, there's a heatness, but it's like from the nose up. And so this opens up circulation, and it's a draining, and it's a mucolytic. Really helpful where there's congestion. I've had people just take grated horseradish, you know, and the thing about grated horseradish is that by itself, horseradish isn't that potent, but when you grate it, you break down the ITCs, the alloisothiocyanates, which are potent antimicrobial sulfur compounds. That's in garlic, that's in onions, this is brassicaceae. And so that presence is crushed. And so we make the tincture, we grate the horseradish, let it sit 10 minutes, and then add the alcohol and water, because the myrisin is an enzyme that breaks it down, and that's when it gets really potent. And this is something that you can really get a burn sensation from it. So a little of this in a formula really helps to create a synergist and a potent kicking effect. So I love the horseradish. Yarrow, my joke with yarrow is it's pretty much for everything, right? I mean, when I was teaching at the Naturopathic College, if I put a multiple choice question, like here's a case, what herb would be indicated for this case, and I put yarrow as an answer, I could never find it to be wrong because it's good for everything. The piece that we look at, the flowery yarrow tops, is that it has these folded leaves and has these beautiful white flowers. It's a bitter, it's aromatic, it's strongly anti-inflammatory and antimicrobial. So it really helps with tonifying the mucous membranes through anti-inflammatory. It contains oils like camozoline, and the yarrow essential oil camozoline is blue. So it says amazing Mediterranean blue colored oil if you ever see the separated oil. And it's really great for, it's antispasmodic. So if there's a lot of sneezing, this is where it's good. It's great for where there's bleeding. So if you get enough irritation, there's some blood coming out. And so by itself, it's just, you got to remember, it's quite bitter. And by itself, it's probably going to be a little bit. So I could mix this with elderberry and tussilago or inula. And that way you have immune, that way you have an antimucolytic, and then this one you have a tonifying, and it's also very, very good as a diaphoretic. So it's warming and it causes the sweating. And so it helps to move the circulation and, you know, that way detoxifying. So that's where it was helpful with fever, because it would help you break the fever by causing you to sweat. And the classic formula is peppermint and elderflower and yarrow mixed together, typically 2 parts peppermint, 1 part yarrow, 1 part elderflower. Make a strong tea of that or a tincture, and then take, you know, a pint or more while you're taking a hot bath. Put cold cloths on the forehead, cold cloths on the feet, or the feet in cold water. Drink it, and then take a cold cloth and wash the body as you get out of the bath, and then wrap up, not to get chilled. And then you go to bed, and the yarrow really helps to bring the sweat out. and that will really help break a fever. That's the alternative to taking NSAIDs or Tylenol, things like that. Just sweat it out, go to bed. In the morning, people usually feel a lot better. So we have some upper respiratory support formulas. Dr. Farshad, you want to come in and help talk about this? But kind of has everything we're talking about, which is so great, right?
Yes, absolutely. So if you're looking for something to add to your patient's protocol that's already blended for you, the upper respiratory support is great. Again, like Dr. Nagel said, a majority of the herbs that he mentioned today are in there. And we do have other respiratory support products. If you want to go to www.wisewomenherbals.com, you can see all the other respiratory support compounds that we have to offer. And next, Dr. Nagel, if you could change the slide, please.
Okay.
Thank you. So right now, our spring into summer sale is happening. So you can get up to 20% off of your order, and that's off of wholesale if you have a practitioner account with us. That happens until the 30th. So if you have any questions, please feel free to contact customer service, and they'd be happy to give you more information on that promotion. And or if you don't have an account with us, they'll be happy to set that up for you as well. And next.
I put this slide in on the upcoming ones, the events in May, Botanicals for skin health. What's interesting about this talk is we're talking about internal use and topical use of herbs because they both can have an important role. In June, we're going to talk about body-mind, and this is the idea of like how do we integrate moods using potentially aromatic herbs as well as internal herbs. So that's the component there.
So if you would like to register for that, you can go onto Wise Women Herbal's website and scroll to the bottom, click on practitioner learning community, and then you can register for those. We will be sending out a thank you email with the replay link as well as information on how to receive the slides from today as well as the study. And then, again, more information on upcoming events. So feel free to visit the website. If you have questions for Dr. Nagel that come up later, he'll be happy to answer those for you. Feel free to email him. His information here is on the screen here. Otherwise, feel free to contact us at Wise Women Herbals, and then we can get you in touch with him as well.
I'm going to unmute everybody because we have a few minutes left. I try to create these so there's time for some dialogue. So I'm going to unmute everybody, and if you have a question, just speak loudly one at a time, and we can see anybody.
Combination of nettles and quercetin.
Nettles and quercetin?
Yeah.
How about using those? Yeah, that's a classic combination because the quercetin is mast cell stabilizing, and you have to remember plant sources of quercetin. Typically, a plant model would be onion skins is like the best source. Okay. I know there's purified quercetin. The challenge with quercetin always is the forms may not be that bioavailable. And so I think of the plant forms as like, this maybe is the chicken soup model, but like broth with all your vegetable scraps, including the onion skins, is a key way that traditionally you got those, but combinations are really pretty good. Was there another question, or is that more of a comment?
That was the question about the viability of that combination.
Now, I'm not up on all the different forms of quercetin, but I know that if you take quercetin as a powder and put it in water, it won't go in very easily. And this is kind of the nature of when we talk about herbal constituents, like in the form of nature, like onion skins, it's beautiful, but the amount in there is going to be so low compared to a capsule. But the synergistic, all the web that it weaves, sometimes that can be really more bioavailable than something that's highly purified. In an herbal industry where they want to concentrate and give you components in there, a lot of times you'll see quercetin, nettles, vitamin C, what we used to call bioflavonoids. The herbal source for bioflavonoids that's probably the most concentrated that you can use easily is lemon and orange peels. And what I would always use is dried lemon and orange peel in the teas, because you get organic dried lemon orange peels, you know, all the flavonoids, especially in the white pithy part, that can be water solubilized into a tea. That can also be extracted into a tincture, and that's kind of your natural source of those. Again, it's not going to be super potent, but it's one of the things that sometimes, because it's a bioavailable, it gets effects without having to be a super concentration.
All right, thank you.
Other questions on the chat line here? The other thing I'll say while you're thinking about a question is that, you know, seasonally, everybody's going to live in a different part of the country, and you really got to work locally with the pollen, so forth, that you have. You know, we think here in the Northwest, like cottonwoods come out in June, and that's really bad because there's a lot of cottonwoods. I would say in general, concept you have in allergies is that dry climates, you tend to have airbornes. Like I lived in Colorado, a very dry climate. And so the thing about a dry climate is the airborne molecules stay in the air a long time, and the membranes get dried out. So the key thing I talked about earlier was hydration. And one thing I found really helpful if you live in a dry climate is saline washes. Super important. Probably if you have an allergenic response, like a seasonal, and you're having symptoms, one thing that I found really useful is just take simple saline solution, whether you buy it in a little sterilized bottle or where you put a pinch and a couple ounces of water. But if you wash the sinuses morning and night, just like you might wash your face in the morning and you wash it before bed, if you wash your sinuses by irrigating with a neti loda, or you know, you can inhale a little water in each nostril until you taste it in the back of the throat, that's a really great preventative, because if you wash away the allergens that you inhale that stick to your membranes, you get less likely to get a response to those. And so that's something I didn't mention, which is a great preventative. Saline washes morning and night, especially during pollen season. If you live in a wet climate, moist, the water will take the pollens out, but you tend to have more mold and mildew and other allergenics. Here in the Northwest, we're crazy with mold issues. So dry climates, you have dry climates, HEPA filters work really well, because the HEPA filters will pull the circulating pollens out of the air. You ever think of that picture of the sunlight going through your house, and you look and you can see all the dust as well as microscopic pollens in there? That's what our nose is all about. And so washing the nose is really, really helpful. You know, it's a non-herbal therapy, but it's super available and cheap.
Any other questions?
Could you touch on something mold specific?
Say that again.
Something mold specific?
As a treatment?
Yes.
Well, you know, all the therapies I talked about herbally are helpful, because as an allergenic response, I would say the thing about mold specifically is that you got to prevent it from growing. And so mildew and mold are kind of on the continuum, and it's a pretty extensive thing. But one of the things, I live in a moldy area, and so one of the things that I try to do is you got to control the humidity. And so dehumidification is really key if you live in a house in a mold. So like I have a basement, I'm actually in the basement now, and so what I try to do is keep the humidity under 50% all winter in the basement in a house. That's really key. Keep circulation good, have no places where the air will stagnate. And so one of the things that I found is you got to keep things away from the wall. Like you know, typically you have the dresser pushed against the wall. I like to put about 6 inches or more there so the air can move. Otherwise, mildew builds up. So moving air, heat will help that. Blow air, dehumidification, and then another piece that can be really helpful is HEPA filters. And in mold and mildew, what I like is low-level ozonation. And there's various machines out there that create small amounts of ozone. Somewhat controversial in that ozone's also an irritant, but ozone can help neutralize the odors, and they can help. Like I had a friend who had a van that got filled with mold and mildew. We pulled an ozonator in there and blasted it for a few days, and that really knocks back the mold and mildew. But the treatments can be the same, you know, like helping the symptomatic relief.
True. Thank you.
Great questions.
Yeah, I didn't put them on the slides because, you know, on some level, you know, we start talking about different kinds of mold, black mold, and how immune, those things can really affect immune system function. And so every area, there's specialized people that can identify the pathogens in your home, and that can be done. Somebody can come in and take a sample and understand what they are, and that's really key.
Any last?
All right, any other questions? Are you muted there?
No, I'm still here, but
All right, well, if there's not any other questions, we'll look forward to talking to you next time.
Alrighty,
Dr.
hey,
Farshad,
thank you, Dr. Nagel.
final comments?
Dr. Nagel, great job today. And thank you for everyone for joining us again. Look out for that email. We'll send you the replay link and information on how to get the PowerPoint slides from today and that research study, as well as Dr. Nagel's information if you do happen to have questions later. So on behalf of Wise Women Herbals, thank you so much, everyone. Have a beautiful day.
All right, thank
My
you.
day pale in comparison only to your very own.
Thank you.